Whenever I come to work on horses, saddle fits, therapy, I like to help owners see the horse that I'm looking at. When you see your horse every day, sometimes it's really hard to see small changes that are occurring. And because I look at a volume of horses every week, certain traits become a little more apparent. I like to have people get behind their horse and, number one, look for levelness in the hips. And this horse, he's fairly muscular here, but he has a twist in his pelvis that brings his tail and his spine over my direction. It may not be readily apparent there, but this point of his hip on the back side where the pelvis meets the femur is very flat. And as you draw a straight line from the point of his hip down through the center of his heel bulbs, you will see that his tendon and his calcaneus, the point of the hock, have shifted over to the outside or laterally away from his body. When we compare that to the other leg, he's dead center. So right here, you may have a low back problem that this is affecting, but unless something is dealt with here or a veterinarian makes a further analysis of whether he's sound or not, this is from an old injury, possibly a conformation issue that he was born with, but it definitely would affect his way of going. One of the views I like people to take of their horses, especially when they're shooting a still series of photo shots for me to evaluate their horse's back from, is to take a picture from back here and look at the height of each hip in relationship to one another and the straightness of the spine. And as you stand on a bucket and look down over your horse's back, I'll be evaluating how straight the spine is, the shape of each set of long back muscles, and the shape of each shoulder blade to one another. Horses that are having problems many times will have a shoulder that's larger, and that'll show up from this view.